Well, starting in mid-October, retail sales of over-the-counter hearing aids are expected following FDA approval. This move opens up new opportunities, but there are a few things to consider first.
Here with more information, today's sponsor, Carle Audiology Department, and Jennifer Black, manager of audiology at Carle Outpatient Services at the Fields, is joining us today. Jennifer, so you are definitely the expert. You have a lot of experience in the audiology world, and I'm sure you've seen a lot of advancements made over the time that you have been working in this department. But let's talk how serious, hearing loss really is.
Well, hearing loss is more prevalent than most people might think. It's estimated that 1 in 8 Americans have hearing loss, and that translates to about 30 million people. And unfortunately, less than 30% of those people who might benefit from hearing aids actually try them. And while there are a lot of factors that might prevent somebody from, taking the next step to get hearing aids, we know that untreated hearing loss can cause significant negative impact to quality of life. It's also recently been linked to an increased risk for dementia.
Okay, can we stop right there? Because I have heard before that hearing loss is sometimes misdiagnosed as dementia, so there's kind of a correlation there. But then for it to contribute to dementia, that's new to me.
Yes, so there was an article in Lancet magazine about 2020 that said that there's an 8% increased risk of dementia in folks with untreated hearing loss.
Interesting.
Yeah. Oh my gosh, I didn't know that.
Yeah.
Okay. So how can these over-the-counter hearing aids help in maybe those that are a little hesitant to go get actual hearing aids prescribed?
So we know that early treatment is important, and what we're hopeful is that the advent of over-the-counter hearing aids and making those more accessible, more available to people will cause them to seek help sooner. The over-the-counter hearing aids are only for adults, and they're only for mild hearing loss. And so what does that look like? Well, if, let's say, you turn the TV up a little bit louder than the rest of your household might want, or you've noticed that when people wear a mask, you don't understand them as well. Or maybe you have an easy time communicating in a quiet setting, but if there's a lot of background noise, you have trouble. So those are all indicators that you might have a mild hearing loss. And for those folks, an over-the-counter hearing aid might be a great place to start.
Who would not benefit from an over-the-counter hearing aid?
So there are a couple of symptoms that we want to kind of highlight that you want to be aware of. If you have drainage or pain in the ear, if you have a sudden hearing loss, so if you wake up one day and you can't hear, or if you have ringing in one ear or hearing loss in one ear, those are not your standard run-of-the-mill hearing problems, and those require medical attention.
So I know that cost can be a reason that people are a little bit hesitant to move forward and getting hearing aids prescribed. What's the cost associated with the over-the-counter ones?
So it's estimated that over-the-counter hearing aids are going to range about $1,000 for a pair, and those again are for mild hearing loss. Prescription hearing aids are going to be on the order of $2,000 to $6,000 a pair, and those treat every degree of hearing loss and are more adjustable, if you will. They can be reprogrammed, so if your hearing changes over time, prescription hearing aids can be reprogrammed. Unlike glasses, when your vision changes, you have to get a new pair of glasses.
Right.
With hearing aids, they're designed to last about 5 to 7 years, and so if your hearing changes, you just have to have them reprogrammed, adjusted based on any changes in your hearing.
So, and then also with the prescription-based hearing aids, if it's not a good fit, you can return it. What about an over-the-counter hearing aid? Do those have a time limit on how often or how long you can return it?
So the FDA has not mandated that over-the-counter hearing aids be returnable, and there's likely to be quite a variety of quality and technology in those products, and so we encourage consumers to check the box and see if it's returnable. Prescription hearing aids are fully refundable after a 60-day trial period. And it's also important to note, too, that in the last couple of years, prescription hearing aids are now often covered by your health insurance. So many health insurance policies have a hearing aid benefit, and that could substantially decrease someone's out-of-pocket cost for aids.
Well, it's exciting advancements, though, for those people who may just be a little too vain to, you know, go the hearing aid route to get that on their own. But lots of great information, and we appreciate you being here and sharing that.
All right. Thank you.
If you want to learn a little bit more about what's happening there at the audiology department at Carle, there's a look at their website, and we'll be sure to connect you over at CILiving.tv. All right, still ahead.